Hi, everyone. Welcome back to another episode of the Slimming Surgeon podcast. I'm your host, Dr. Candace Kickler. Today, I have a very interesting guest. I have Dr. Vassilia Binensztok. She is a licensed and board-certified mental health counselor who specializes in the treatment of adults with childhood trauma and anxiety disorders. She's the founder of Juno Counseling and Wellness, a private practice in Palm Beach Gardens, Florida, right down the street from our hosplastic surgery office in Gardens. And she provides individual and group therapy to adults, teens, children, and couples. Additionally, Dr. Binensztok teaches graduate level counseling courses at Northwestern University. She supervises counseling students and interns and runs a popular mental health Instagram, which is where we kind of met, that focuses on childhood trauma recovery. Dr. Binensztok also serves as vice chair of the board for Vita Nova, a local nonprofit that assists homeless youth, and is a graduate of Leadership Palm Beach County. You can definitely learn a lot more from her Instagram, and I'm going to tag it in the show notes, but it's at Dr. Vassilia. Or you can check out her website, www.junocounseling.com. So thank you for coming on, Dr. Vassilia.
Thank you so much. It's so nice to be here.
Thank you. I know we were just talking about Florida and the weather, and while it's a little dreary outside, it's still probably better than like 90% of the rest of the country.
I know. I definitely feel bad for a lot of people, having been someone who's originally from up north and went to school up in New England. I know it's no fun being stuck inside. So
I know. We're lucky. So we met mostly on Instagram, I think. Like we happen to have offices like 3 doors down from each other, but we met through social media. When did you kind of start your social media account, and like how has it blossomed into what it is today?
So I actually started my social media account, I think in 2017. I really just didn't do a lot with it. I started it to just promote my private practice, and all I really did was repost other people's posts. Or I did this thing I called Satisfying Video Saturdays, where I reposted videos of like ASMR stuff, things like that. And I had some moderate success with it. And then at some point I realized I had to create some content that was original in order for it to really stand out and be my own Instagram. Even though there have been a lot of great accounts that have grown in size exponentially, just reposting other mental health content. I just kind of wanted to do my own. And so I experimented with different things. I kind of started out in that model of making lists. Like here are 5 things that you might notice or things that you might try or something like that. And then I kind of moved a little towards just writing tidbits and quotes and things like that. And that really took off in 2020, which is actually surprising. I wrote a lot of different quotes or thoughts that I had, and I literally like woke up one morning and one of them was reposted a lot. And then I just started getting like thousands of followers at a time, which was just wild to me. And then it hasn't been exponential since then. It's just kind of been incrementally growing. I think I have a niche audience. Mm-hmm. It's really about adult survivors of childhood trauma, things you might have experienced, things you might not realize are connected to trauma or things you've experienced in the past. And so, my audience tends to find me, and hopefully I speak to them. And I tell a lot of my own personal stories as well on there, which I don't do in a lot of other venues. And so I kind of just thought, whoever resonates with me, that will be my audience. And I just put that out there, and that's kind of how it's gone too.
I love it. I mean, I have been following you for some time now, and I feel exactly the way you're describing it. Like I connect with some of the things you say, and it makes me think, and I'm like very engaged in your content, because it's like, oh my God, I'm a survivor of childhood trauma. Like I feel like all of us on some level are. Is that true?
I think a lot of people don't realize, I'm working on a self-help book right now. And that's really the first chapter, which is coming to terms with the fact that something you experienced might have been traumatic. Because usually when I have clients come in that have had some sort of childhood trauma, they tend to downplay it, which is something I've done personally myself just a really long time ago in my own healing journey. They tend to say things like, well, my parents were doing their best, or they just didn't know better. I was a difficult kid, or everybody goes through that. Or the big one is there are worse things. Well, at least I wasn't trafficked, or something like that. And it's like they think of the worst possible thing they think could happen to someone. And if that didn't happen to them, then it must not really be so bad. And so really the first chapter of my book is just coming to terms with the fact that this did happen. It is wrong, whether someone meant to do it to you or not, whatever you believe. And it does have an impact, and it is real. The impact is real.
It's so interesting. Yeah. I mean, when you describe it that way, most of us, I'm sure, have had some type of trauma, childhood or later, and it impacts what we do every single day in our interactions with everyone.
Yeah, it definitely can. I think a lot of people don't realize I think people are kind of changing a little bit to understand this new model of trauma. But I still feel like most people think of the old model of trauma, which is they think of what we call like a single event, big T, big trauma. So they think of a war veteran or something like that who experienced an explosion or something really horrible like that. And they don't think about the things that we can experience as kids, or they don't think about what we call little T traumas, which are smaller events that sometimes can accumulate over time. And they especially don't think about chronic trauma. So say someone grew up in a household with domestic violence, where one parent was hitting or emotionally abusing the other, or sometimes both doing it to each other. And that's just how they grew up. And that was maybe, 16, 17 years of life. How do you quantify that in the old PTSD model? And so a lot of times people just say, well, things were rough, but we got through it. They kind of say general
I'm a better person because of it.
I'm a better person because of it. And sometimes they are better people because they healed from it or in spite of it or something like that. But yeah, it's exactly right. They'll say things like that. And so they kind of don't always view that as trauma, even though obviously it is.
Right. So what do you think about when you talk about daily or chronic trauma? What do you think about, and I consider this, the trauma of like social media and the negative things that come with that? Like, are you seeing a lot of that in your practice?
Yeah, I do see that. I think that's just something that we have to deal with now as therapists, is understanding how social media affects people. Obviously, bullying on social media or comparing ourselves to other people on social media. I see it a lot actually in couples, where they'll compare their relationship to other relationships on social media. Well, my friend's boyfriend posted her or made a Valentine's Day post, and you didn't do that. So our relationship is not as good or as strong because of that. And I see a lot of things like that, which, I mean, I guess it might sound silly or petty, but the truth is, in this day and age, those things are so significant that it is kind of valid, and I kind of do see where people come from with that.
And it is part of our daily life.
It's part of our daily life.
Like we look at it every day, multiple times a day. So like to think of it as just like an accessory to your life.
Right. It's not.
It's not.
Yeah. Or, what happens to people in certain groups, Discord groups or Facebook groups or things like that are either the group becomes a toxic environment or they're kicked out of the group. They don't belong somehow. And we're thinking it's like a made up world. It's like a bunch of people that never actually met in person before, but it's real. It's a real part of their lives.
It is. That's so interesting. How do you what advice would you give a parent if their child is dealing with a lot of issues that are from social media? Yeah,
that is such a hard question. I think the first thing that comes to my mind is to take it seriously. I think a lot of parents, even myself, we were raised, people my age even, we were raised in a generation that didn't have social media. When I was in middle school and even early high school, it was dial-up internet. So there was no social media. Yeah. Facebook came out. I'm actually I'm a Facebook dinosaur. I'm like one of the first people who was ever on Facebook.
Yeah.
Because it came out when I was in college and I was in an Ivy. And after Harvard, it went to the Ivies first.
Yeah.
And so I'm like number 4,000.
And then it came to me.
Yeah.
I was in college, but it was a real university. It wasn't you couldn't get in. It was
staggered.
Right. It was totally staggered. It was like hierarchical.
It was hierarchical.
Oh my God.
That's so true.
It's messed up.
People our age, we didn't have to deal with that kind of stuff. And so I think a lot of people, especially the older they are, they're really quick to dismiss it. Well, just log off.
Right.
Well,
just don't be on it.
Yeah, just don't be on it. And you can't escape it. That's the world that's really been created, where if you're being ostracized online or being bullied online, you really can't go anywhere on earth and get away from it because it is literally worldwide at people's fingertips all over the world, So I think my first piece of advice would be just don't dismiss it. It is real. Maybe find someone for them to talk to, maybe someone who understands or who's kind of closer to that generation, and some of it is the same kind of counseling and work that you would get for, bullying that was happening in person as well, just learning to like yourself, finding a community you do belong in, trying to not internalize those messages, trying to stay away from them. Yeah, obviously we can't completely log off, but just trying to put them in perspective, I think, somewhat.
Yeah, I know it can definitely be challenging. I mean, I'm sure you, as well as we get messages from time to time that can be offensive or can be insulting or can be, some form of bullying. And it's like, yeah, some days those hit me harder than others.
Definitely. Yeah. It's just wild how that happens, especially, to someone like me or you and, me being in this field, knowing better,
right?
Helping other people through it. Sometimes I get some weird comments or, I remember someone commented on one of the photos of myself that all my clothes were ugly and I looked terrible and all this kind of stuff. And I was like, well, that's mean. Yeah, just delete it, block it.
Yeah.
And then later you're like pulling that dress out of the closet and you're like, oh, do I really have bad taste? Do other people think this? And it's like, how ridiculous. But at the same time, those comments are really sticky.
Yeah. What I find frustrating with social media and the online bullying is that so much of it comes from people who would not dare to say these things in person. Yeah. And that's why it's hard, because it's like they're saying what's on their mind, but in a real life person-to-person setting, maybe they wouldn't ever speak those words.
Absolutely. I mean, that's in psych, we call that emotional distance. So it's funny. It's actually the same concept that applies to things like drone warfare.
Oh.
Yeah. It's a lot easier on the psyche to drop a bomb on somebody when you're doing it from
a computer,
Washington, D.C.
Yeah.
And you're like, you just like on a joystick. I don't know if they're really on a joystick, but
we'd like to think they are.
You're really far away.
Yeah.
You don't feel like you're taking someone's life. And it's actually the same concept. So the closer people actually get to each other physically in the same vicinity, the more likely they are to come together to not hurt each other, to do those things, because the average person is not violent or hurtful in that way. There's something about that emotional distance where you don't feel like it's reality exactly, or it's like a real person, and the empathy goes down with that distance. And so you're more likely to say things that are just atrocious or really harmful.
This is so interesting. So I do want to definitely make sure we talk about plastic surgery while you're here.
Yeah.
Because I could talk about social media all day. Like that's like my jam. But we know, I mean, obviously and I know that plastic surgery oftentimes is a very emotional decision, whether you're making it for yourself or for someone else, or, if you have issues with self-confidence and you're not really addressing those and you're trying to put a Band-Aid on it. Like, what are your thoughts? And do you see a lot of people who maybe have done stuff they shouldn't have, or I don't know. I'd just be interested to know your opinions about it.
That is interesting. It's definitely a tough topic in psychotherapy because we are in this era of body positivity, which I completely agree with. But I do also understand, I guess everything's on a spectrum. And I guess there's a spectrum for plastic surgery, and some plastic surgery is a necessity where it's not necessarily just cosmetic, it's to help us maybe after an accident or a reconstruction or something after cancer or something like that, So, but aside from things like that, I do believe obviously in loving yourself. And I do believe, especially as someone who grew up before we really knew about things like Photoshop and airbrushing. I mean, I remember being in middle school and tearing out pages in magazines of like this perfect women with perfect skin, perfect everything, not knowing that wasn't real and thinking I had to look like this. And I was like, why do I have pores and she doesn't have pores? And things like that. So I'm really sensitive to that. But I do understand that some people can do a procedure where they're not addicted, quote unquote, to procedures, and it makes them feel better about themselves, and it's not necessarily a dangerous or bad thing. And I get that. So it's really hard to kind of figure out how to, with each client is an individual. So how do I, with each individual client, kind of gauge, is this something that's reasonable? Is how do I encourage them to love themselves as they are? Because if they don't, and that's really the core issue, the cosmetic procedures are not going to help that. You know, they're not going to change that. You're always going to find something else wrong that you think is wrong with you, you know? But also empower them to do the things that they want to do. You know, I mean, plastic surgery is really common, and I don't think it's all necessarily surgery going under the knife. Obviously, there are other cosmetic procedures. I've had some myself, you know, I admit all the time I get Botox. I've had a little filler. It makes me feel better about myself. I will say that I feel better about how I look since I've done some of those things, but I don't think that's necessary for everybody. And I wouldn't just say, yeah, go ahead and do it to just anyone. So it's just such a fine line to walk. I guess I really just try to listen to each individual client, how they feel about it. I've had some people where they're pointing things out on their face that they're telling me they need to get fixed, and it's not there. I mean, I have eyes.
Yes.
I'm looking at it.
And, like a full body dysmorphia type thing.
A full body dysmorphia. And one thing I tell people to do when that's the issue they come in with is to stop analyzing themselves in the mirror for at least a good, some time, a few months. Don't look at your face in the mirror. No 10x zoom in mirrors.
Oh my gosh. Those are the worst.
No pinching yourself, your different body parts in front of the mirror after you get out of the shower, pinching the stomach, all these things. Because I've had people show me, I need this. I need a lipo. And they're like, you see this fat? And they're pinching their skin.
Yeah.
So I've definitely seen that,
Those are the people I tell you're not a candidate.
Right. And then I'd hope, that the other thing is that they go to a qualified person like yourself. They get a good opinion. They don't have to rush into anything. And someone who can just give them an objective opinion, like, look, this might help you if this is what you want to achieve. Or, maybe you should talk to someone. I don't know that I'm seeing what you're seeing.
No.
It's just such a gray area.
It is such a gray area. And I'm glad that you brought it up as a spectrum because there are people that I see who have really unrealistic expectations or think that it's going to change their life. In all areas, aside from just the way they look physically.
I see.
And those people, I tell them, I don't think this is right for you.
Wow.
And maybe this isn't the time. Maybe you should do something later, but right now you're not in a good place. Like I've had to have that conversation several times. It's hard because obviously I want to make money and I want to do my job.
Right. Yeah.
Right. But, if someone's, throwing up every red flag and it's like, for example, I had, an instance one time where a patient was like, I don't sleep. I binge eat. I spend all my money on shopping. So I might as well spend it on my body. And I was like, this is just not good. Like, this is not where we need to be.
Yeah.
Yes, you have a cosmetic, indication, but it's not the right time for you. So it's hard though, because, there are other people who may hide these things and who may not tell me that they're having all of these issues at home or internally that are affecting the decision-making, capability. But, it is interesting. And I do agree with you that body positivity in my line of work is important because I want people to be happy and feel good about themselves. At the same time, I do see if they have a cosmetic concern, what we can do to make it different or adjust that. But my thing with body positivity is I don't like when it goes to the point where we're telling people it's okay to be unhealthy. When it's like, okay, yes, you've got a little extra fluff or puff or whatever, but now you're morbidly obese. That I think is taking it to the extreme in an area that I don't agree with body positivity. What do you think about that?
I actually think about this a lot, and I'm sorry to say I don't have a really definitive answer.
Yeah, of course. I know this is more like,
I know. And
what's our brain? What's in our brain right now?
I'm one of those, it depends kinds of people, and I'll give you like every angle of things. And I actually think about this a lot because I don't know the answer to it. And it's obviously something I have to think about a lot for my profession. And we do, we are governed somewhat by some trends in, the zeitgeist, like what people generally believe. in the current moment, in the current time. And that's good because I think as a culture, we are always progressively moving forward and becoming more enlightened on things. But it is possible that the way that we view things will change over the years, just as a society. But what we do with that, with what we believe now, is we tell people this is how you should feel. This is what you should believe. This is what you should believe about bodies. This is what you should believe about X, Y, and Z, where some of those societal beliefs might change over time, and then if somebody dictates what they do based on that popular opinion, whatever it might be, whether it's positivity or whether it's you need to change yourself kind of mindset, then they're not really being true to themselves. This is their one life to live, and they're basing their decisions based on what the general population is the mass is sort of believing right now at this point in time. So yeah, I do. I think that we have done really well to move away from, the 90s, like
anorexia,
heroin chic.
Yeah.
That some of these, when I used to watch some of these shows like Friends and stuff, and these are like the most beautiful girls I'd ever seen. I wanted to be like them. And then I look at them now and they've come out and said how unhealthy they were or how little they were eating, Yeah, I think it's great that we moved past that. I don't know what to say about, when people are really overweight and to the point, I know
it's affecting their health.
Scientifically, extra weight on the heart, extra weight on the joints is not healthy, right? I do also know that people can be a smaller size and never work out, eat poorly, drink a lot of alcohol, and
also be unhealthy.
Be less healthy than someone who is a much bigger size, who maybe gets cardio and takes care of themselves. And I think we also think that all of that is due to food consumption and being sedentary. Right. And it's not, there could be a lot of things that make someone just a higher weight. So I don't know, it's really hard for me to tell. I guess what I would say is that each person needs to listen to themselves. Like, how do you feel physically and emotionally? Not compared to other people, not compared to what you think you should believe or how you think you should look or what you think the message should be. Do you feel good? Do you feel, if you're wearing clothes that fit your body, that's very important. I tell a lot of clients, buy clothes that fit your body. You feel better about yourself right away. If you're doing that and you're still not feeling good or you're feeling tired or sluggish or your outside doesn't match your inside or, then maybe you might want to make a change. If you're doing that and you are feeling good, then maybe you don't want to make a change, So I think I would just say, how can the individual tune out those outside messages, whatever they might be, and really come to their own conclusions about what they think their body should look like, or, what kind of body are they living in, because all those standards, they've changed. Bigger bodies were popular at one point. Tiny bodies were popular. And now, it's big butt is popular.
Right.
Which is
small boobs are becoming popular. Yeah, right. No, I know. So, it's a cycle.
And it's going to keep changing. So just do you,
Exactly. It's like our bell-bottom jeans. They'll come back in style.
I think they are coming back.
No, they are for sure. I wore some the other day and they looked
90s
amazing.
Is the new vintage,
Yeah. Isn't that sad? We're like, vintage is like what we used to wear. Okay. I want to talk more about trauma because I know that's kind of like your specialty, and how it impacts like our everyday living. Like, what are some signs that someone who, like myself, maybe isn't as educated on this on this topic, what are some signs that we have trauma that are maybe showing up in our day-to-day life or in our conversations or in like our interactions with other people?
Yeah, that's a great question. I think the first thing that pops in my head is, as we were talking about that body issue and the weight issue, there are a lot of people who have experienced trauma, and putting on weight is a comforting defense for a lot of people who've had sexual abuse, things like that. And for, what we were talking about, maybe for someone like that, looking at what is going on with their body is more focused on the trauma lens, and not necessarily on the looks or anything like that, or health or anything like that. But most people compartmentalize, pack up their trauma, stuff it way down, put it on a shelf, and go on with their lives. because we're kind of forced to. The world doesn't stop. It's a lot like grief. Somebody passes away, you're grieving, the world keeps going, doesn't care that you're grieving or not. And so they start to think that trauma is not affecting them, and then it just sprouts up in different ways. Maybe a difficulty opening up, difficulty letting someone in, difficulty being intimate, like as in physically touching your partner or talking about deep emotional things with your partner or something like that. Holding yourself back, not putting yourself out there, not meeting new people, not applying for a certain job or something like that because you have a deeply held belief now that somehow you're not good enough, because shame, feelings of worthlessness, low self-esteem, these are really common after effects of trauma, especially childhood trauma, when you're really forming your self-view. You're really coming to figure out, how do you see yourself? Who are you? And how do you fit into the world? We also see things like unhealthy habits. So maybe overuse of alcohol, maybe not taking care of one's body, like not going to doctor's appointments or dentist appointments, like even basic dental cleanings or things like that.
Yeah.
Letting things slide, like letting things slip that you would be doing to take care of yourself, whether it's keeping up something in your home, or like I said, making a basic primary care physician appointment or something like that. I see a lot of financial problems when people have trauma. Like you said, I think you work with someone who is overspending, underspending, which a lot of times people, right?
They like hoard everything.
Yeah. People don't think that's an issue because they're like, wow, you're a good saver, but for a lot of people, they have a lot of fear and anxiety over spending any amount of money, and all these things tend to trigger a fight or flight, which we don't label as a fight or flight unless you're educated in that realm in some way. And I don't mean school educated. I mean, you just learned about trauma.
Yeah.
So fight or flight often in the day-to-day looks like just getting stuck, not doing something for yourself you're supposed to do, running away from things, avoidance, not dealing with conflict well, either shutting down and avoiding it or creating conflict when there isn't any. And you can see this kind of get in the way of people's functioning.
Yeah.
It can go all the way from not being able to get out of bed in the morning, not being able to, make a meal for yourself, to just things like not being able to have some close friendships or seeing opportunities pass you by because you felt too stuck to move when they were coming your way and you didn't think you were good enough anyway or something like that.
So if you are someone who feels like maybe you have some trauma, but you can't put your finger on it, like you can't, think back, okay, what in my life could have caused this? Like, what do you recommend somebody does? Or like, should everybody be getting therapy just for the sake of having therapy? Like, serious question.
Yeah. I mean, that's a tough one because I think that anyone can benefit from therapy in their lifetime.
I've been to therapy before.
Yeah.
So for the listeners, it was so transformative during a certain part of my life where it was like, I was heading into a place that I knew I was mentally unwell and I needed to talk to somebody and just like talk to someone openly, candidly, and have conversations that I wasn't necessarily comfortable having with other people or that were slightly confidential, And so for me, it was very helpful postpartum and in the early part of my career.
Right. And sometimes you don't want to hear the answers other people have because, sometimes they don't know what they're talking about, straight up. And a lot of people are uncomfortable with difficult emotions and they want to get past them right away by giving you a solution. Well, why don't you just do this? Have you tried that? Or telling you it'll all be okay. You just got to feel better, be positive, And some of that stuff is not necessarily bad advice. It's just not what you need to hear in that moment. You really need to hear something more, need more validation sometimes. So you need to be with someone, talk to someone who can sit with heavy things and difficult emotions, which sometimes our friends can't, I mean, they're just, otherwise maybe they would have become therapists or something. Yeah. So I think anyone can benefit from therapy at some point. Obviously, I don't think that everyone walking around needs therapy all the time or that everyone has necessarily some hidden trauma, some people have things that they don't realize they could tweak and improve. It's like if you say you're really healthy and you go to the gym all the time, right? You can always have another fitness goal, or you can always have a tweak on your routine that you didn't realize at this time in your life or at this certain place makes it better, makes it easier, whatever it is, you know? So you can always have something like that. So I think that a lot of people could benefit. As far as a lot of people ask me that question of what if you suspect you have a trauma, but you don't remember what it is? And that is like a really bad area. So psychology has kind of a bad rap. It's really a newer science. I mean, it is over 100 years old, but if you compare that to the other sciences or other fields, that's not that old, right? Mm-hmm. And so a lot of people were learning as they went and did a lot of things that we now know are super unethical. And one of those things was like in the 50s and 60s, with good intentions, people were trying to help, and they were trying to help some people remember their traumas. And some people ended up implanting false memories of things like sexual abuse that didn't happen to people.
How?
Yeah. And this was like a well-intentioned thing. Yeah. And there are some cognitive scientists, psychologists who've done research on this. And the research it's helped guide us in our procedures and ethically as practicing psychotherapists. And it's also really helped inform witness testimony and the way that police interrogate people, especially the way that they interview children if they've been or accused someone of abusing them or something like that. So it's really changed those protocols for law enforcement, which is super interesting. Yeah. So that they're getting
the real answers.
They're getting the real answers, and they're getting fewer false reports. And so if you try to bring up a memory of something like a sexual abuse, that's usually the most common one people ask me about, that you think happened because when your significant other touches you, you kind of flinch, or you don't feel comfortable with your body, or you think you don't remember, 5 years of your childhood, which is common with trauma, right? Or something like that. And you think maybe something happened around that time. I won't try to help you figure out what that was, because it's impossible to do it and guarantee that no false memory will come up. Because it's very easy to ask leading questions, and then the person start to believe something, and then you verify it and say, that sounds right. And then they really believe it. I mean, there have been a lot of studies that show horrible. You can easily implant false memories of anything in people. Yeah, wow. Especially children.
Yeah, of course.
There's some really interesting studies about they implanted a memory of in children of them getting lost in the mall. There was a specific study where they told children, and it was the way they asked, where they said, what happened at the mall? The kids would say, I went there with my mom and did whatever. And when they asked, do you remember when you got lost in the mall? They say yes. And if you keep asking them and they keep retelling it, you bring them back a few months later and say, what happened at the mall? And they say, well, I got lost.
Oh my gosh.
Yeah.
And they really believe it.
Yeah.
Oh my gosh. This is horrible.
So, I know. Because I get asked this a lot.
Don't do that to your kids.
I know. I get asked this a lot. I think this happened to me. Can you help me pull up the memory? And what I tell people is, look, treat the symptoms.
Okay.
Because at the end of the day,
that's what you're trying to do. That's what you want, right? You want to fix the problem, which is the result of whatever may or may not have happened.
Yes. And you don't necessarily have to analyze and reanalyze something that and remember even did happen in order to treat what's happening now. So we can get you out of fight or flight. We can get you feeling better from depression, from anxiety. We can help you with your self-esteem. We can do all these things without you trying to remember something that you think happened that you don't remember. Yeah.
This is so interesting. Yeah. I have like a horrible memory. So
oh my gosh,
you could implant anything in me and I'd be like, sure. Yeah, it definitely happened. What are your thoughts on in like situations like this, or when people are trying to deal with trauma? Something that I find is trending lately is people doing like hallucinogenics and ketamine and different things like that. Like do you feel that's helpful? Like, have you had patients with experience with that?
Yeah, I think that there's a lot of potential there. I just don't think we know enough about it yet.
Yeah.
And how it should be administered. So I know that the federal government, and this is amazing, is sponsoring some studies using MDMA for PTSD. And I don't think that's just a matter of like taking MDMA and your PTSD is gone. I am sure there has to be some sort of protocol. Surely. And therapy and things that go along with that, you know. I have heard anecdotally of people using psilocybin, like mushrooms, or going down to Costa Rica and
like ayahuasca.
And what they say is they take it once. There's no sort of therapeutic part of it. And then they are not depressed for 6 months. And I mean, if that works, you know, then
I guess
that
that's
works.
a good thing.
I don't know much about ayahuasca, but I know psilocybin, from what I know, doesn't have, it's not addictive and it doesn't always necessarily have adverse effects.
Right.
So I don't know, to each their own, but I think that's still being studied.
I'm so paranoid. Like, I feel like if I did something like that,
I would lose it.
I would lose it. And like, what would be the outcome? I'm like
like
control freak. Yeah.
I'm a control freak. I'm over controlled. I could never do that. But ketamine, so there are a lot of ketamine places popping up.
There are. I have a patient who goes regularly for ketamine infusions.
Really? And I don't know what your patient experiences, but mine...
She loves it.
Really? Yeah. I had one person I worked with that loved it and said that they were able to just pull apart their beliefs on issues in this weird way where they could kind of see it in this meta way and change their mind. It was like... I was like, I want the ketamine, you know, that was like, sounded amazing. And then I had someone else who had a terrible experience.
Really?
Where they felt like they were like on the edge of the earth.
Oh,
God.
And
they just felt.
See, that's what I would fear.
That's probably what I would feel too. Yeah. And so, and for either of those, there wasn't a therapeutic component. And I do follow this woman on Instagram. She's an artist. And she's really open about her journey. And she's gone to a lot of ketamine therapy. It's not here in Florida. And there was a therapist there, a psychotherapist, that then helped her unpack it after each session and do some journaling. And she loved the experience. So I think there's a lot of potential there. I would hate to see it be something that becomes like more of a money-making venture. I mean, we need to earn money off of the things that we put our time and effort and education and energy into and financial investment into a clinic like that. I do get that. But at the same time, I don't want it to be like a mill where it's like, oh, come get your ketamine, infusion. I think that would be good if it was structured in a really therapeutic way.
Yeah.
But I'm interested to see what happens with that. Because I think if
time will tell. Yeah.
I think the other thing is people want a magic pill. They want
that's
panacea.
true.
Yeah.
Right. I wouldn't think it'd be a good idea to just go do that, but then not be actually working on yourself.
Right.
Or like talking through some of the things you're trying to work on with someone else. Like going to see a therapist.
And I wonder how many people do. I bet there are people who do that because they don't believe in therapy or
maybe they had a bad experience.
And therapy doesn't work or something like that. And then they're like, well, I'll go for this 5 times and I'm going to be cured.
Yeah. Probably not going to work like that.
No.
But I think therapists, just like plastic surgeons, like you have to find someone that fits with you because everybody's different. Everybody has a different personality. And like to what you were saying, people have different methods of treating the problem.
Absolutely. And someone you trust, right?
Yeah.
I think you and I have similar jobs in that respect, is that people are really trusting us with a lot.
Oh yeah.
And it's a big responsibility. And so if they if they feel like they can trust you, I mean, we were trustworthy people and someone might just not feel that, they might not connect to one of us. But if you can feel that, I think that's one of the most important things.
I love it. Okay. This was kind of along the lines of the trauma. I wrote this question down for myself. Are there certain actions or routines that or certain steps that you have to get through to overcome your trauma? I mean, I know it's going to be personalized for every different person, but is there like the stages of grief, like that people read about? Are there certain things that you can identify in a patient? Oh, they've done this, so now their trauma is better. Like, is there anything that's like tangible or identifiable like that?
Yeah, kind of. Yes and no. In the book I'm writing, I do have areas that you should target if you're recovering from childhood trauma. So they might be behavioral, somatic, so the neurological, the fight or flight stuff, or they might be cognitive in terms of your thinking and things like that. So I do think that every person who comes in, usually they have to pull from some of those areas, and some more than others where they're having problems. Sometimes there are stages in that you might not be able to change your behavior until you get out of fight or flight. You might not be able to change your beliefs until you change your behavior, So there are things like that. But I think it's like super intertwined. It's always intertwined and overlapping. Actually, a lot like the stages of grief, So people don't necessarily move through the stages of grief 1 through 5. They go 1 to 3 to 2, back to 1, up to 4, back to 1, Yeah. And so different things happen. That's kind of the general process. So I think it's a little more like that, where it's, overlapping. And
I love it. It's so interesting. I mean, it makes me think about so many people I know that are probably dealing with some trauma. Just because of the way that they interact or respond to different stress throughout the day and things like that.
Yes, respond to stress. Like I ask people that a lot. Are you responding to this issue, or are you responding to a former issue or something you believe? Like those are those quote unquote triggers, or something now reminds you in some way of something from the past.
Right. So crazy. So, you were kind of talking about, you touched on this, and I actually wrote it down as well. What do you think about I would call it the hype, but where manifestation and things like that are pushed today? Don't worry about your finances, just manifest more money. Don't worry about being successful, just believe you're successful. Do you deal with people that say things like this, that come in that have tried manifesting something and it didn't work? And or what do you think about people pushing this in culture today?
Yeah. Okay. Yes.
Because I like to believe it too. I'm like, yes, you're right.
Yeah. I could talk about this all day. Yes. So I like manifesting personally. I would never recommend to someone that they manifest, because that is not ethical or therapeutic in any way.
Right.
It's not scientific, but I personally like manifesting. And I do believe for myself that if I can kind of visualize what I want, see myself doing it. And I think there's some science behind this, that if I can see myself there where I want to go and I can feel it, that I don't think that it's necessarily that I'm going to magnetize it to me, but I'm definitely going to make different decisions because of that feeling and that experience that I had, that dream. I'm going to be able to kind of figure out where I want to go and backtrack from there, and maybe believe that I can get there because I kind of seen myself there in my mind's eye. I do believe that we attract different things in different people based on how we feel. And I think a lot of that is just through our actions, Mel Robbins kind of tries to, bridge that divide between manifesting and the science. And she says your RAS in your brain, reticular activating
system. Yeah.
Thanks. If you're thinking of a red car, you're going to see red cars because your brain is going to start screening your environment for that. So if you think about this kind of success and you visualize it, you're going to start experiencing it, and it's because of your brain. So she kind of tries to pull the two things together, which I think is kind of interesting. A little less on the new age spiritual side, which I've been really into in the past. I've really read a lot about manifesting and the new age and stuff like that.
I read books about it too. I totally find it interesting. And I do feel like you can attract the right people, the right energies and things like that.
Yeah.
But I feel like it can also be abused, and maybe can misguide people.
I think it can. And say for your health, there is actual science that shows that people are with certain mindsets are more or less likely to overcome cancer, for example, right? So that your mindset has a lot to do with it, right? But then we start telling telling people that you don't have mental illness, you're manifesting it. You're in a domestic violence relationship because that's what you're attracting. No, that's just what happened to them, right?
Right.
And there is a cyclical nature to things like domestic violence. So we tend to come out of an abusive household growing up. We're more likely to get into an abusive relationship, and then more likely to get into another abusive relationship, and so on. But there are reasons for that we can identify concretely that are not just I'm a vortex for abuse because
Right.
I'm creating it. I think that is really harsh.
Yeah.
But if you look in the manifesting literature, there's some crossover with actual psychotherapeutic techniques. So there's a technique we call acting as if in Adlerian therapy, which I've heard that exact term pulled into some of the New Age, which is super interesting to me. Clearly, I kind of geek out on connecting psychotherapy with things.
Yeah.
But acting as if basically says, don't wait to be a confident person who would apply for a good job. Because you're never going to feel that way if you don't make a change. Change your behavior. What would you be like? What would you be doing? How would you be acting? How would you be dressing? How would you be walking if you were that person? And just do it now before you even feel like that person. Embody it. Fake it till you make it kind of thing. And a lot of that is kind of like in the realm of manifesting. So I do think that manifesting can work in some ways. Maybe there's a spiritual part of it. I don't know. I can't say yes or no, but I think there is a psychological component to it that does work. And I think like any spectrum, it can go into this place where it's like almost abusive. Yeah,
totally. That's so funny. When I used to do weight loss surgery and do like a lot of medical weight loss with people.
Yeah.
And I would tell them, act and eat and exercise and wake up every day feeling as though you are that goal weight or whatever you want to be. So I was doing as if therapy with them and I didn't even know it. That's hilarious.
So true. Yeah. Because if you wake up and tell yourself, oh my gosh, I'm broke.
Right.
I don't have the job I want. I don't have the relationship I want, whatever. I'm not in the shape I want to be. That's kind of what you're going to get because you're setting the stage for how you feel and it's going to affect your choices. And I think that's exactly what you're saying. Wake up and say, I'm feeling the way I want to feel. I'm reaching the goals I want to reach. And it's going to affect your choices.
100%. Awesome. So one of the things you posted recently was about like erratic parenting and things like that. And that to me, I was like, oh my God, I totally experienced that growing up. And I don't want to do that with my children.
Right.
But another thing that I see a lot on social media is about gentle parenting.
Yeah.
Like, should we be gentle parenting? Should everybody be gentle parenting? What does that mean? Like, what are your thoughts about parenting?
Can
you give us that in 2 minutes?
Yeah, right. I don't have children myself. I will say that. I think parenting is so difficult.
Yeah. Hardest job I have.
It's so hard. And I think it's harder in this day and age because most people don't have that village.
Correct.
Even and I'm not saying that we should go back to the 50s because there was a lot wrong and it was a lot wrong for women. And so many women were really miserable in their roles and had no upward mobility. But there was a time, and I'm trying not to fall into like a Pollyanna effect here, but there was a time when I think that some people did have more of a village, or weren't saddled by these kinds of childcare costs.
Yes.
It's just
crazy.
It's just so much and on parents. And then now, it's really good that we have all this information on parenting. And a lot of it is based in neuroscience, like the whole brain child idea of how to gently but firmly speak to your children in that authoritative way that helps them not only follow directions, but actually learn and understand why and be able to self-soothe and govern themselves. But it's also a lot harder. So I think parents used to have this experience where they got instant compliance from kids, and then they would deal with the after effects later on. Because if you're what we call authoritarian, your kids listen because they're afraid in that moment. And then there's a big backlash where they don't know how to make their own decisions. They don't know how to self-soothe. They rebel in just, really bad ways. And so it's good that we know more now, but I think that there's so much pressure on parents.
There's a lot of pressure
to do the exact right thing.
All the time.
Because
everyone's watching you. That's what we feel like these days.
Yeah, right. Yeah, I can imagine that. And then if say your child has some issue and you take them to counseling, a lot of parents don't want to hear what they could be doing differently. And I think for some people, it's because they feel like they're doing everything that they can, and they're still not perfect and they're still not good enough. And what's the perfect parenting that you can possibly do? And what they're not thinking of is there are so many other factors that affect how your kids turn out besides you as a parent, their peers, their own personality. They come into this world, about 50% of our personality is from inherited traits. They come into this world with a temperament and personality already forming, and that determines how you parent them. What kind of kid are they? What kind of relationship are you going to have? That determines who they're friends with. And then you think about their school environment, the greater environment outside of that. There's a theorist called Bronfenbrenner who did this whole system analysis that like the nuclear family is the inner system, and then you kind of keep having these circles that move outwards until you're all the way out into like society and the government and messages, social media and the messages that we get, right? All those things are affecting your kids. You're one factor. Granted, you're the most consistent factor there. You're the closest to them. And so you're going to have a lot of influence on them. But there are other things that you can't control that are also raising your children. And the other thing is I actually wrote a book. It's a textbook that you can find on Amazon, but it's about, I had my history was working with the Department of Children and Families with abused kids. And I've done some contract work since then with that system and family courts and things like that. And one thing I found was what happens when people are in that gray area of should the state intervene in their families or not? So how bad does a parent have to be for the state? You don't always want the government to come into your life and dictate how, if you should even have your children in your home, right? How bad do you have to be to warrant that? And just how good enough do you have to be to not warrant that? We have to make that call. And I think we often think about the extreme ends of that spectrum, but what about the gray area in that spectrum? Especially mine is multicultural take, my book. So what about when multicultural factors are affecting that family? And I created this model, and there's research to base it, and I kind of pulled it all together, just called the adequate parent. What is good enough? And the truth is, obviously, we want to go above and beyond, give our kids everything they possibly could have within our means. But within your resources, if you love your child and you communicate it and you care about them, and you nurture them, and you have some reasonable expectation of their developmental milestones. You're not expecting something of them that they can't do. And you keep them safe, and you don't expose them to danger, and you're stable enough, as in not on drugs and, not dealing with some sort of, say, serious chronic untreated mental illness or something like that. They're probably going to turn out all right.
Yeah.
Yeah.
It's that simple. / that difficult.
Yeah, right. That's all.
Yeah. It's a lot. I mean, it's just like, I have two, and I see exactly what you're saying and how they already have their own personalities and their own temperament. And that's at age 1,
yes.
Cam is so different than Charlie. They have their own little quirks. And we deal with them. And so, we already kind of talk to Cam a little differently than we did Charlie, just because of the way they both respond. It's so interesting.
Yeah, it is. Mm-hmm.
Oh my gosh. Parenting. We could also talk about that forever. So I kind of want to end with maybe you giving some guidance. Like if someone has an issue in their past that they're trying to overcome, or they're trying to heal, and maybe they are seeing a therapist or maybe they're not, but like, what are some steps that you would recommend someone to take if they're trying to really push forward?
Oh, obviously, of course, it depends, what they're healing from. I guess, my first thing I would say is to lead with self-compassion. So I think a lot of times, and, I'll say this, I am super guilty of this, is we beat ourselves up a lot. Hold ourselves to a high standard. We think we're worse off than we are. We think we're not doing better enough, doing well enough, healing fast enough, healing the right way. And I think, and obviously I'm part of this world. I think that it really helps to have all the information that we do on social media and just how accessible information about mental health is these days. But I feel like, when I log on and I look at this stuff and I read these accounts, or I read a self-help book or something, it's not new. It's not new information to me. And I can sort of sift through it and actually find a nugget or something I hadn't thought of before, or written in a way that I hadn't heard before. And that's wonderful. But I try to imagine, say you have never entered that realm. You're just now learning about mental health and you're, like you said, seeking help for yourself. It is so overwhelming. And you're just inundated. What should I do? Should I regulate my nervous system? Mm-hmm. That's the new thing, which actually is really helpful and like super works. Yeah. But there's so much information on it. How do I do it myself? Do I need DBT? Do I need ACT? Do I need CBT? Do I need EMDR? Do I need internal family systems? Is that going to help me? Is this going to help me? Should I go to therapy with my spouse? Should I go with my family? Should I confront my family now? Should I cut them off? What kind of boundaries do I need? It's like, there's so
I feel like I've asked all these questions to myself at some point. It's hilarious. Yeah. Should I do an intervention?
Yeah. Should I do an intervention? Do I need an intervention? There's just so much information out there. And so I'd say all that information is good, but I think it gives people this idea that they have to be doing a lot to be healing and that there's this right way of healing. There's a formula to healing, and there's a right way and the wrong way. And I think that if you're just questioning, if you just do one thing differently and see if it works for you, and if it doesn't, trash it and do something else. You know what I mean? Mm-hmm. Or if you just try things out or make a small change, a 10% difference or something that you do, and you do it in a gentle way, not like, I'm such a mess, I need to do this for myself. If you're like, approach yourself with kindness, like maybe you would to a friend, and gently talk to yourself and gently try out one of these techniques, whether it's with a therapist or on your own, mm-hmm. And give it time and understand that the truth is not only is there no timeline, sometimes you'll do something and it's giving you results and you won't see the results for a while. They kind of have this cumulative effect. And then one day you notice, oh, I handled that differently. That's amazing. I worked on that 8 months ago, So if you just kind of be gentle with yourself and try not to get overwhelmed, you don't have to be doing all the things all the time. I think that is probably the best way to start.
I love it. Okay. While you were talking, I came up with one more question. Okay. Because I see this with people, relationships. Mm. What do you advise when you see maybe a couple and one maybe picks apart the other one a lot or really finds a fault in the other person that may or not really be there? Mm-hmm. And they're adamant that they need to change, but that person doesn't want to change. Like, what do you think about that dynamic? And is that relationship doomed? Do people just need to give it up? Like, I see it all the time.
You do?
Yeah. Oh, and like family members and friends. And it's like, he'll be great. He just needs to this, or she's amazing, except this, but then it's something that they fixate on and they focus on. And it's like, but they don't want to change that.
Yes. Yeah, that's so true. I had that joke that I say that some couples come in and they're like, I love this person. They're the person for me. They're the one I want to be with. They just have to change every single thing about their personality.
Yeah, right.
Sometimes people love what they think the person is.
Yeah.
And they're not seeing the real person. So first thing I ask myself, and sometimes then, but usually myself when I see that, is what are they complaining about? Are they complaining about an action, something that can be changed, or are they complaining about a trait, who the person is?
Yeah.
And most of the time I've noticed couples are upset about a behavior that actually can be changed. And maybe the person wants to change if they're able to see how it doesn't really help them or help their relationship. But whenever they're upset about a trait, I just tell them, I say the thing that you're upset about is kind of who this person is. And it's not necessarily a bad thing. It just might not fit for you.
Yeah.
And then it's a matter of acceptance. None of our partners are perfect, right? Is this something that you can live with? Or is it something that you can't live with? Is it something you can live with if they made a 10% change, but they were still the same person, but they kind of approached it a little differently? When it's something like that, maybe you're just not a good fit. And that's what you have to consider.
Yeah.
Not necessarily that it's like this. If they tell me he doesn't listen to me, I tell him one thing, he tries to solve my problem instead of just hearing me out. That can be changed. And a lot of people have that problem. Mm. If they tell me this person has a set of values, or they like to do this in life, or they are this way, and I don't want to give examples because they're specific ones I'm thinking.
Yeah.
Then I'm like, that's just who you're with.
Yeah.
And I don't know if you actually really like your partner or want to be with that. Do they actually even fit you or something like that?
Right.
And then I also thought about like the manifesting thing, because you said when people fixate on those things, and it's like, they're fixating on the negative aspect. There could be so many positive aspects and fixate so much on the negative aspect that they start only seeing that. And you can look at that in that. I know in the manifesting world, they talk about that. And then in science, like when you think of a red car, you're going to see a red car. You start to amplify it. And that's like all you can see. And are you attracting more of it? Are you creating it? Are you, whatever it is, that becomes the dominant thing in the room. And you stop seeing all those things about your partner that you liked at some point.
Exactly.
Yeah.
I know. Good advice. Good things to think about. Totally.
Yeah.
I really, really enjoyed this conversation.
Yeah, me too.
Thank you so much. I feel like everyone needs to follow you because of your daily tidbits and all the thoughts that you put out, because they've helped me a lot. And so I know if they're helping me, they've got to be helping a lot of other people too. So tell us again your Instagram handle.
It's Dr. Vassilia. My name, Vassilia. I always have to spell it out.
And if you're local, she's in Palm Beach Gardens.
Yes, I remember I followed you because you're right next door.
Yeah.
And then I saw that you were doing this podcast. And so I was just kind of following that along. And then I saw you walk by my office window while I was doing therapy. And I was like, that's her.
I know. I was like, wait a minute. So awesome. So great.
I love that.
Yeah, no, I mean, I love how we've been able to connect. And I think this was such a super fun and interesting conversation, and people are going to learn from it. So again, thank you so much for coming on.
Thank you. Yeah, this is super thought-provoking. I had a really good time.
We're all going to go do ayahuasca now.
Yeah. Let's go down to
No, just kidding. We would never. So thank you guys all for listening. Please make sure, if you aren't subscribed, to subscribe. Leave me a 5-star review, nothing less, because I need good ratings and we want to get this podcast out to the people. And thank you again, Dr. Vassilia, for coming on.
Thank you so much. It was my pleasure.